2020 is shaping up to be the deadliest year in U.S. history. Early data from the CDC projects the nation is on track to see more than 3.2 million deaths this year. That's at least 400,000 more than 2019. And that increase is largely due to the coronavirus pandemic. Cases in the U.S. have topped 18 million. More than 322,000 have died, and the holiday season is expected to worsen this crisis. Many U.S. airports have been swarming with travelers despite warnings from health experts to stay home. The TSA is seeing its busiest week since the pandemic began. Meanwhile, top U.S. health officials say the new coronavirus strain spreading in the U.K. is likely already in the U.S. Both Pfizer and Moderna are now trying to determine if their vaccines are effective against this variant. Mola Lenghi begins our coverage in Newark, New Jersey.
More than 80 million Americans are expected to travel between Wednesday and January 3rd. As you can see, they've already gotten started. That is despite the CDC's recommendations. Add to that the new strain of coronavirus that's believed to be significantly more contagious, and hospitals across the country are bracing for impact.
Tonight, growing concern that the variant strain of COVID locking down much of the United Kingdom has now reached the U.S.
When you have this amount of spread within a place like the U.K., that you really need to assume that it's here already.
The lockdown stranding travelers, leaving rows of trucks stretching as far as the eye can see and then farther. France now saying it will resume essential travel and transit for European Union citizens to ease the gridlock. While the new strain is believed to be up to 70% more infectious, it's unclear if it might require the vaccine to be modified.
It is possible. I think we should be ready for that a bit down the road that might happen. But I'm not worried that the current vaccines we have will somehow become ineffective against this variant.
Pfizer and Moderna are testing their vaccines against the new strain. What is worrisome?
Code blue, ICU north, bed 18.
How bleak things have gotten inside U.S. hospitals, especially in California. This is a COVID unit just north of Los Angeles.
It's getting worse and it's exhausting.
Dr. Brad Spellberg is Chief Medical Officer at LA County USC Medical Center.
What is the worst case scenario here?
Our fear is we end up looking like New York did, in April, or Italy went through. That when you are just systematically completely overwhelmed and there is nothing you can do.
19 is positive.
There are no ICU beds left at this Orange County hospital.
It's been exponentially increasing since Thanksgiving,
sparking new concerns about a Christmas surge nationwide. Those warnings so far largely ignored as airports remain packed. A coroner in Louisiana now confirming that the passenger on this United Airlines flight, seen on this TMZ video, died from COVID. One of the passengers giving him CPR reportedly now testing positive. In September, the U.S. never averaged more than 50,000 daily cases. California just reported over 60,000 in a single day. The state also setting records for hospitalizations and deaths. Relief can't come soon enough for those newly infected, those hospitalized.
So 1, 2.
Or those on the front lines.
How do you go on?
It's our job. We continue to come every day walking towards the danger. We're willing to do the hard work. We're willing to go into the rooms and care for these critically ill patients. Please just help us stop the spread.
Well, Dr. Spellberg says it is important to point out that it's common for viruses to mutate and to spread more during the cold winter months. Still, it could create an unsustainable situation at many hospitals across the country, which is why Governor Andrew Cuomo in New York is calling on all New York hospitals to begin testing for that new coronavirus strain. Tom?
Important to keep in mind. Mola Lenghi, thank you. The CDC's guidelines for who should be next in line for coronavirus vaccines are leading to more questions than answers. States and labor unions are now debating who should be on the priority list. Adriana Diaz explains.
It's week 2, with more than 600,000 vaccines administered, including to Dr. Anthony Fauci today. The CDC recommends the next group should be those 75 and older and frontline essential workers. But that's 49 million people, and so far, just under 5 million doses have been delivered.
Do you feel like you're almost in competition with other essential workers?
Yes, for sure.
Sylvia Tanguma heads the teachers union in McAllen, Texas. She eats in her car to not remove her mask at school. Monday, Texas announced its next group will be those either 65 and older or at high risk, not teachers as a whole.
What would you say to the governor if you had a chance to talk to him?
He needs to consider how many teachers we have and how badly we are needed.
After studying New York's surge, the CDC found that corrections officers are most exposed. That's why Anthony McGee of Chicago thinks that they should get priority.
They have to pass out medicine, they have to pass out food. There is no way for our members not to have direct contact with inmates.
Infectious disease specialist Dr. Eileen Marty says the order of vaccinations must be both ethical and strategic.
You vaccinate the right group of people, you are going to flatten the curve faster.
But the CDC says even those next in line will be waiting at least a month. Adriana Diaz, CBS News, Chicago.
All right, now Dr. Teresa Amado joins me now. She's the Director of Emergency Medicine at Long Island Jewish Forest Hills. Dr. Amato, thank you so much for joining us. The CDC says the new coronavirus strain that's spreading in the UK may already be here in the U.S. There's so much we just don't know about this variant strain. How concerned should we be? And if it is already here, how could this impact our efforts to reach herd immunity?
So it's not unusual for viruses to go through changes and mutate and have different variations. It's what viruses do. It's what bacteria do. And we've been very smart in the medical community and the science community, always finding ways to combat these new strains, whether it's a bacteria or a virus. So we go through this with the flu season every year. We know there's variations in the flu, and we create these vaccines. And what I would say is, even if your vaccine isn't as effective, it should be at least somewhat effective. So I'm not worried that it's not going to be effective at all. We're just going to have to see if it's going to be a little less effective than we thought it would be with this new strain. But I put my faith in the scientists. They are starting to look to see whether the vaccines we have currently are going to be able to be as effective against this new strain. But again, not unexpected. We knew that this virus would at some point start to mutate.
It does seem a little bit like deja vu from the spring when countries started to shut down travel from Italy, from China, and now we're seeing this again. So at least 40 countries have banned traveling now to and from the UK. Should the U.S. do the same here?
That's really hard to say. I've been watching the news and listening to Dr. Fauci, and I would say I would think that new strain has probably already made its way here to the United States, and we're probably going to start seeing it if it isn't here already. I believe it probably is. And what we've noticed is if you start to close borders after the fact, it doesn't do much to change the spread. Really, what's going to change the spread of this new strain will be people's behavior. Keeping the social distancing, wearing the mask, avoiding large groups and gatherings. If this new strain is here already, which again, I think it probably is, we know it definitely is much more transmittable. So more than ever, we really need to follow the guidelines of distancing and wearing our mask.
Adhering to those very simple social distancing, those scientific measures that have been given to us for months now. Meanwhile, scientists in the UK are investigating claims the new strain may spread more easily in children. Obviously, we know that children have been hit a little less hard so far with this virus than the rest of the population. What more can you tell us about this?
So again, this strain does seem to be more transmittable, but there is absolutely no evidence that it is more lethal, deadly, or causing more side effects or worsening outcomes. So we know that viruses, what they would like to do is spread. So anything they can do to spread more quickly is what they're kind of designed to do. So I don't know that we're so worried that children will get sicker from this, but they may become people that will spread it more to our folks that are more in danger, like our older adults. So I think the more concern is if this is more transmittable in children, which it may be, there needs to be a little more study on that. But if it is, it's not so much the children that we're worried about, because we've seen most of them do very, very well. But it really is the concern of transmitting it now to older adults that are maybe in their family or their loved ones.
And there's some implications there when it comes to sending kids back to school. Should kids go back to school if this proves to be something that children can transmit just as easily?
Yeah, so that is such a tough question. I'm not sure the right answer to that. We do know that social isolation for children is also not good. So we have to kind of look at both sides of that. How do we keep them socializing, because we know that's important, and quite frankly, getting a good education. We also have to temper that with, how transmittable is this going to be, and will it now put some other people in danger, if not the children themselves, again, our older adults and people with risk factors. I don't think there's an easy answer to that question. I really think it's going to be something we have to really, really think about and be very mindful for the risk and the benefits.
Yeah, it's such a tough balancing act. Officials in California warned there could be nearly 100,000 hospitalizations in January. Much of the state is already under a stay-at-home order. So what's behind California's surge, and what do you believe needs to be done to stop or at least lessen the spread?
So again, my heart goes out to see them out in the West Coast. I remember what it was like here in March and April, and I see those videos, and it brings me right back to the time where we were at, where we just felt very overwhelmed emotionally day after day. I know they're talking about that they're getting very low on these ICU beds and hospital beds, but I will tell you, you get very inventive when you're in the middle of this, and you create space, and you will find a way to take care of these patients, because that's just what we do every day. We make as much capacity as we have to. So I know that they're going to get there, and I know it's been weeks for them, and I really feel for them. I don't know exactly what's leading to them surging the way they are right now. We were expecting a surge due to the holiday and traveling. We know after Thanksgiving, we saw a bit of a surge here as well, not as bad as they are out west. But it's really hard to say why they're really having such a surge. I do know that once it starts to spread, it can go very, very quickly. And so I'm not at all shocked that they're going through it. I'm a little bit, again, my heart goes out to them. I'm feeling very sympathetic towards their plight right now.
Yeah, it certainly goes back to what you said about human behavior being the first thing that we can do, the most important thing we can do to prevent the spread of this. Now, as you mentioned, some hospitals in California have run out of ICU beds, and we're seeing facilities across the country nearing their limits. How do we keep our healthcare system from reaching a breaking point here?
Yeah, so one of the things that we did was something called load balancing when we were really at the height. Instead of looking at capacity of individual hospitals, looking at things like a whole health system, for instance, or even your whole state or neighboring states, and looking for capacity in different places rather than just in the four walls of your hospital. Doing things like building a tented area, or using things like parking lots for patients. Really, nothing's off the table when you're surging like this. And so I think that's probably what they're starting to really look at, is how do you increase your capacity when individual hospitals are kind of getting near to their total, beyond their capacity. So again, I really think that becomes like a logistics issue. But when smart people put their heads together, they tend to figure out how to do this. So I do have faith that they are looking at different ways to care for their critically ill patients. But it does get extremely emotionally draining as the weeks go on.
Yeah, the things we're seeing unfold right now, unimaginable to so many Americans before this pandemic began. Well, thank you for your work, Dr. Teresa Amado. Thank you so much for your time as well.
Thank you so much.